Good morning, everyone. Good morning. This is a tough task. Born in Rhode Island. We lived in Mississippi, Italy, Iceland. She graduated from Escambia High School as a valedictorian of a class of 400. Wow. She went on to on a presidential scholarship to Florida A.M.E, to medical school on a public health scholarship. She is now Vice President of Health Diversity at Florida Blue. She is their COVID spokesman. She's my daughter.
Say it again, bro. Say it again. Say it like you mean it.
And I'm very happy to present Dr. Kelli Tice.
Good morning. Good morning. Thank you, Daddy. I know y'all knew he was my daddy. All right. He's still telling people at the post office and Winn-Dixie and everywhere else. My daughter's Dr. Kelli Tice. And I'm not mad about that. I'm not mad about that. And I stopped apologizing for the gift of having parents who are so incredibly proud and who sacrificed in order to ensure that I had the opportunities that I had. And who also instilled in me the value and the importance of coming home. So my on-paper assignment is to talk about COVID and respiratory symptoms, and I will get to that, I promise. But there is another assignment, and I will spend a bit of time this morning talking to you about you, helping you to understand how our health is impacted by things that are very often outside of our control. And it is what we remain uninformed about that allows us to continue moving forward without everything we need to be as healthy as we can. This is an awakening time for many physicians, right? Particularly physicians who are not of color. And what I mean by awakening is they are learning that there's this thing called health disparities, these differences in outcomes that exist between groups. And I've had colleague after colleague approach me and go, I had no idea, wow. I've been doing health disparities work for my entire career. Before there was a Chief Health Equity Officer position at Florida Blue, I am its first ever Chief Health Equity Officer. These are not new problems. They're not new problems. They have been ignored because we, who are impacted, are uninformed, and often are silent about it. So this is the time. So health equity, health disparities, health inequities, you hear all these terms, right? Health equity means that everybody gets the same chance to reach their highest level of health. Everybody has the same chance. That means that the barriers that exist that might keep you from reaching your highest level of health, those are removed. Okay, we'll talk about a little bit more about those barriers. Health disparities, those are the differences. And I'll talk about some of the data that exists around that, the differences in outcomes. So the fact that African American women are more likely to be diagnosed with breast cancer at advanced stages of disease and are more likely to die. It's not more common in Black women, but Black women are more likely to die if diagnosed with breast cancer. Come on. My 24-year-old son is seated here. I was pregnant with him. I was a married medical student. Okay, he was wanted. He was coming into a home with both parents. Okay, he had less likelihood of reaching his first birthday than if he had been born to an 18-year-old unmarried white woman who hadn't finished high school. When is enough where that's concerned, right? A Black woman who's in the hospital, in the laboring process, who feels like there's something wrong, right? Something just doesn't feel right, is more likely to be labeled non-compliant, belligerent, angry, difficult, right? Whereas a white woman, similar situation, is informed and advocating for herself, okay? Black women get ignored. That's the reason that things like doulas and other birth supports actually help with outcomes for Black mamas. Because you need somebody in the room who can say something on your behalf, because you will be judged. I've got to empower you. I need you angry enough to decide that the resources we lose in our communities, the women, the mothers we lose, the babies we lose, the older adults who develop end-stage renal disease and end up on dialysis for decades, the folks who lose their vision to complications of diabetes that could have been presented, the people who lose limbs, the human capital that we lose in our communities that are a direct result of health disparities, I need you to decide that that's not acceptable. This is your call to action. How many is enough? Our pews should be filled. And often, the glory years, when our elders should be pouring into us, are influenced and impacted by their need to be at the doctor, right? By the damage that's been done that could have been prevented. There are things you should know about your health that should influence your health behaviors today. Racism, right? And it's a word that folks aren't comfortable with in certain circles. Many of my colleagues are very uncomfortable. As a matter of fact, when they hear things like racism, right, they shut down a little bit. You know, they want to back up from the conversation. But it's a thing. We all know it's a thing. It's a thing. Here's where we've missed it. We know where it shows up. We know how to prepare our kids to manage an interaction with police officers. Hands on the steering wheel at 10 and 2, right? We know how to prepare our kids for what they might experience in the school setting related to racism. We know how to advocate for our children with teachers and with school administrators, right? My dad mentioned that I was Escambia's first black valedictorian, but what he didn't tell you is that year they didn't want to have a valedictorian. They didn't want to have a valedictorian. Right? We know how to fight those fights. Okay? But I graduated in 1988. My parents are still going by the school to make sure my Hall of Fame picture is still on the wall. Okay? We know how to advocate for our children. But what we fail to recognize is how racism shows up in health. Do you know that most of the tests, most of the studies, most of the data, most of the information was gathered from a mostly white population? The characteristics, the symptoms of heart attack, characterized in 50-year-old white men. So guess what? Your heart attack might not feel that way. It might not feel that way. Did you know that a lot of the tests, the tests they use to check your oxygen level, right? You had that little thing stuck on your finger. Do you know that it can be artificially high in black people because of the presence of pigment in your nail bed? Come on! But this is the number that they make the treatment decision on. This is how they decide whether you need to come in the hospital or you get to go to the house. But the test itself was not created for people of color. So racism shows up in medicine, and we hadn't been talking about that. I started doing a series of lectures in the community called What Your Doctor Wishes You Knew. And one of the things I would say to folks is, you got to be a consumer of your own health care. And if you're not getting what you need to take your health care dollar and move down the road. You don't engage in your care, you just get the information from the doctor, right, that you don't understand most of the time. And then you get home and try to figure out how to make some sense of it, right? For some period of time, my parents would just call me. They said this, and this. What do you think of that? Well, everybody doesn't have that resource in their family, okay? And here's the thing. You shouldn't have to go home and decode what your physician said to you. You shouldn't have to. I talk about racism and bias in medicine, but it's also driven by some of the things that cause the problems that we are constantly trying to solve. Financial strain and poverty, where we are overrepresented in those numbers. That's a result of racist behaviors, right, that preceded us by decades, centuries, right? The way our communities were developed, districting, redlining, right? The bias that exists in how blacks are portrayed. Think about it. If you don't interact with black people, and what you learn about blacks, you learn from the shows you watch and the stories you hear, what is it that you learn about blacks? Tendency toward violence, right? Not very smart. Okay? Those are untruths. But that's the reality of most folks who are functioning based on their lived experience. That's why representation matters. That's why we need to see black excellence depicted by the media and in the entertainment industry. And it has health impacts because we know bias shows up in healthcare. It all matters. But I need a regular physician. I need someone who knows me, who can learn me, right? I'm not going to the urgent care every time something happens. I need a physician who knows what happened last month and 5 years ago, right? Continuity of care. But studies have continually proven that outcomes are better when people of color have physicians of color. Babies are more likely to reach their first birthday if cared for by a physician of similar ethnic background. Okay? I'm not making this up. You're not deciding to be on dialysis, right? What you're deciding to do is to stop taking that blood pressure medicine that makes you feel a little funny. And because you don't have a relationship with your physician, you're not asking anybody about it, you just not take it. And you don't feel too bad anyway unless your blood pressure get high. I feel like I stepped on a toe over there. It's okay. It's all right. That's why I'm here. Can't live without my fill in the blank. Right? I can't. I can't. Yes, you can. Actually, that's how you'll live, is if you do without that. Right? Let's be in moderation. Let's be excellent in how we eat. And the faith community becomes an example of that. Right? How often do we offer a healthy alternative? Right? How often do we model the proper behavior? So there's definitely opportunity there. But that's not all of it, right? It's not all what you do, right? There's some things, yes, you need to not let get in your grocery cart, absolutely. But there are other things. Can we be physically active? Okay? Yeah, we can. We can. Are we physically active enough? We can do better about that, right? It's 30 minutes of aerobic exercise. That means your heart's got to be moving at a good clip. You can't hold a comfortable conversation. 30 minutes most of the days of the week. Okay, most of the days of the week. There's 7 days of the week, right? Most is not 3. Right? It's not 3. Yeah? Like, so don't, like, you hear it and then you go home and apply it like the math changed. No, it's most of the days of the week. It's not 3. And it's exercise, right? So, I imitate this one sort of patient of mine who, I don't know why, I'm not losing. I've been walking, right? And this is what the walk looks like. You seen her in the neighborhood? Yeah. Right? She's chatting with her friend. She's not out of breath at all, right? She can speak in complete sentences. You're not working hard enough, right? You have to do enough work that it's hard to hold a comfortable conversation. And I just need you to get over that. Like, there's no fun, okay? It's no fun. But, let me tell you what I think. I think that some things in our diet, barbecue, where you're taking animal protein and you are burning it, charring it, right? That great flavor that we love is not good for the wall of our gut, okay? It's not good. It hurts. I know. Yes. Hurts me too. But here's the thing. If we were taking care of our guts, even those things we do occasionally, if we managed our gut health, made sure that we were using probiotics, so we were having regular emptying of the gut, then things like that I worry about, sort of sitting against the wall of your gut, wouldn't stay there so long to cause a cancer. Does that make sense? Mm-hmm. So if you are eating enough fiber, if you are not eating barbecue every day, and you are doing something quarterly or monthly that is a good cleanse, a juice cleanse or something like that, then your colon health improves, and I think your risk of cancer comes down. I think it's diet related. Right? Back to what we said we can't do without. So if you can't do without it, do better.
That's it.
Okay? I hereby authorize all of you, under the sound of my voice, to challenge your medical professional. I know I'm not the average doc, but if you have a physician that will not, isn't sort of responsive to your questions or feels threatened or challenged or insulted or something like that when you pose a question, you need to start shopping for another doctor. Because like you're wanting to know about your health, like maybe I could get offended if you had a question about my colon, but I shouldn't get offended if you have a question about your colon, right? Right. So if that's the dynamic, then you really need to reconsider that. Now, speaking for all my physician colleagues, I know what it's like to have 30 people scheduled, 15 minutes with a person, right? And an inability to get through everyone's question. But the way you handle that and manage that, I think, is really important, is really critical. I would usually say something like, today I want to address the things that I think put you at greatest risk. Let's make a follow-up appointment, and I can address the rest of your concerns. You may be concerned because your pinky toe is giving you a fit. Your pinky toe is keeping you up at night, right? But I'm going to address your heart and lungs first, okay? But your pinky toe was top of your list. Let's come back and talk about the pinky toe. Right? That's the sort of interaction you should have with your physician. HIV is another condition we've been just talking about for so long, and health disparities. And there are a number of things in medicine that I tell you, if they were happening to white people, white women in particular, well, we would have been had that fixed, right? When black women became the group in which the number of HIV cases was growing the fastest, I didn't see any shifts in the industry to help solve that. Just this past week, I saw the first commercial that said, hey, you can take this medication to prevent or to decrease your chance of developing HIV if you know you're at risk. First commercial ever that was directed at black women. We've got to know what we're at risk for so that we can take the appropriate action. We cannot wait for our lives to be important enough to other folks for the systems to change. Are more likely to be diagnosed with psychosis, schizophrenia, right? When in fact the real diagnosis is depression or anxiety.
That's right.
The way we are viewed, more violent, right, contributes to medical bias, especially in the mental health field. Black women are more likely to be diagnosed schizophrenic after pregnancy, and it's postpartum depression. Come on. And schizophrenia, like those diagnoses are disabling conditions, right? You can't hold down employment, right? But it's an inaccurate diagnosis most of the time. Even when blacks can be accurately diagnosed, they are less likely to receive the indicated standard of care. So even if you get my diagnosis right, it's depression or anxiety, I'm less likely to get what the industry says I need to manage that condition than a white counterpart. We gotta wake up. We need more blacks in the mental health field. And we need to be able to talk about it for ourselves, right? While y'all are around here talking about be strong and pray, there are folks who actually need help in our communities. And we are not helping them by refusing to call it what it is, right? The head's on the body. And these conditions make other conditions worse. And our failure to acknowledge them as a community continues and perpetuates that disconnect. We have to get over that. As I like to tell my team all the time, nobody's coming to help. We have to figure it out. Now I expand that statement to our community. Nobody's coming to help us. The governor of Louisiana, or one of the senators for Louisiana, said a few weeks ago that the maternal health data for their state wouldn't be so bad if they took out the black women.
Yeah. Yeah.
Right? Nobody's coming to help. So I'm charging each one of you with being informed, being aware, and creating accountability where you go. Understand that the racism we have grown up in, that we have taught our children to manage, that we have advocated against, shows up in our health, and it has to stop. Thank you for your attention. Thank you for the invitation, and I wish you all the best. God bless.